Hello everyone and a very warm welcome to all of you into my channel A to Z Therapy with Smruti. This is your host Smruti Sikta Mishra. I am an occupational therapy and clinical psychology student. So come, join me on my journey of becoming a therapist and let's learn together.
Uh, so tell me more about your experience with other kind of treatment modalities, because you had experience with allopathy and the surgery you had with the Amri Hospital of hip replacement was also a miracle of the modern medicine. So what are your experience with homeopathy and other pathies practiced in India for ankylosing spondylitis? Yeah.
I will tell you that I will suggest you not to go to those kind of treatments for this, because that will not properly treat you. That may suppress your symptoms, but this disease is disease cannot be treated with medicine or anything. It can only be suppressed or kept aside with the help of yoga and exercises and physical activities. You
Okay.
cannot uh, fully recover from this with the help of any kind of medicine. That will only suppress your symptoms. And yes, medicines will help you to improve your quality of life, but you cannot be with those medicines. And many of the medicines which I had taken that have adversely affected my immune system. I was taking a medicine of Ayurvedic, and that medicine made my body such that I was not responding to any kind of medicine, any kind of different medicine. It may be allopathy or homeopathy or any kind of medicine. I
Okay.
was immune to all kind of which drugs he was mixing in that medicine. I was not aware. Uh, in 2015, I went for electroacupressure.
Yeah.
That doctor suggested me to stop that medicine as it was giving me relaxation in just 30 minutes. So he suggested me that must be a drugs or steroid, so which will affect my liver and kidney
Yeah.
soon.
Yeah.
So at that time I stopped using that.
Yeah.
But that
It was a great, yeah. It was a great piece of advice and experience sharing from Chinmay. So the audience must underline this point that what happens in India, that we have everything available just at our doorstep. We need to just go and have a look on it, and we are there. For example, we have costly and corporate big hospitals, we have government hospitals, we have quacks practicing, we have small physicians having their own clinics, we have new tech giants like Amazon and Apple coming in future in the healthcare sector. So what the patients must understand is that don't run behind good advertisements and good sayings and all that. Just have a look on the physician's background and the patients they are treating, and have a recheck and look on the kind of treatment he's doing. Just like Chinmay underlined that how can somebody or some drug give a relaxation for a inflammatory condition in just 30 minutes? It means that something unusual is being done with his body. So that might be a steroid or some kind of drug which should not be used. So that's a very common practice in India. So I must tell you guys that you must have a great look on that. And I guess that Chinmay, you come out of this vicious cycle very early. That was a great thing, because I see patients suffering from this kind of vicious cycle. Moving on, Chinmay, can you tell me more about your experience? Yeah, a big disclaimer here, because a lot of listeners might be having a good influence about Ayurveda and homeopathy. See, I'm not here a person to comment about any kind of pathy. Everybody is practicing medicine and in their own field. What I support is that it should be evidence based, and it should be legalized, and it should be practiced by somebody who has got a proper license, and as well as the medicines are perfect, and not something like quackery and some kind of medications put into some kind of pudia or something like that. So that is a very common practice in India. So just stay away, guys, from that kind of quackery and stuff, and support evidence-based medicine, be it homeopathy, be it Ayurveda, be it yoga. Always support evidence-based. That's what I will suggest. Moving on.
Well, thank you so much for great pieces of advice from both of you. Well, my next question to Chinmay sir would be: you started suffering when was it that you started really suffering more due to ankylosing spondylitis?
In 2015, my right hip was fused. I was diagnosed by this. At that time, I was thinking that it's a stretch in pull in nerve system, or that's that was the explanation given by some doctors, that
Mhm.
it must be a pull in muscle or in nerve system. So muscle relaxer were given to me, but it doesn't work. And then I was really very depressed with that condition, because I was unable to take a single step from my bed. And then I was suggested to take acupressure, and that helped me a lot. And after acupressure, and then Reiki. Reiki is a
Yeah,
treatment, touch therapy treatment.
yeah,
Uh, yeah, many of the viewers might not know about that, but you can search in
yeah,
net that it's a
yeah,
quite different kind of treatment, but it's
hmm,
really helpful for my condition.
yeah. To
I
add on
started
to it, yeah,
work.
yeah. Go on, Chinmay,
Yeah,
go on.
yeah. I started working with that treatment only, and I was unable to sleep in the attack of 2015. I was unable
Mm-hmm,
to sleep for 7 days and 7 nights. I was in
mm-hmm,
such a severe pain. So
mm-hmm,
at that time, my father's friend were practicing that Reiki and acupressure both. They
mm-hmm,
came and gave me both at the same time. When they were
mm-hmm,
giving that, I first slept that night, and
mm-hmm,
that was my motivation to go to that side of the treatment.
mm-hmm,
Before that, I didn't know about this kind of treatment also available here.
mm-hmm. Yeah, so the audience must get some idea about all this kind of alternative therapies. See, guys, be it Reiki therapy, be it acupressure or acupuncture, these are quite effective in some kind of particular diseases. I will say inflammatory and diseases which have pain associated with them, be it spondylitis, be it shoulder pain, be it frozen shoulder, or some kind of inflammatory conditions which are associated with various rheumatological conditions, be it arthritis, ankylosing spondylitis. And just like Chinmay mentioned, there are a lot of practitioners of acupressure, acupuncture, and Reiki in our society. So another piece of advice: before you have a therapy with them, do look for their certifications and licenses, so that you are not cheated and you don't land up on the wrong hands. But yes, I always say that do practice evidence-based medicine. And coming back to Reiki, what happens is that it has got its origin from Japan, just like acupuncture had got its origin from China. So in acupuncture, they use small needles and they used to press some points in the body, because some points have got associations with particular organs. In Reiki, what they used to do is that they try to heal the body by the use of energy. So that can be any kind of form of energy, but mainly they use their hands. And for more knowledge, you can just have a look at the YouTube and Google. And I hope you guys will have a great learning there. But I repeat that before you go to a therapist like this kind of therapist, do check their licenses and accreditations. That's my piece of advice. Yeah.
Hmm. So, anything else, sir?
No, you can go on.
Okay. So how was your medication adversely affecting the whole of your body? Like you were on steroids and a lot of medications you were taking.
Yeah.
Yeah.
Some of the medicines adversely affected by affecting my eyes,
Mhm.
and sometime I got rashes in my hands and backside also,
Mhm.
and that produces a different body odor also,
Hmm.
and those are some kind of side effects I got from the medicines. Some medicines made my vision blurred,
Hmm.
and also reddish
Red eye.
red eye. Yeah.
Yeah.
Okay.
So yeah, to add on to it, what happens is that you take any medication. These medications don't have a 100% activity on a particular receptor. They act on multiple receptors. So what happens is that if a medication has to act on a receptor, you say A for apple. So, and it has sensitivity to act on B and C receptors simultaneously. So what will happen is that if a person requires a drug only to act on A receptor, the drug will be simultaneously acting on B and C receptor. So the patient might have a symptomatic relief from the symptoms due to the A receptor, but might land up with adverse effects, or what we call generally as side effects, for B and C receptors. So for the audiences, for any medication you take, you have side effects, but there are some documented side effects. So just like now you all listen about the trials going for the vaccines. For the drugs, there has been a lot of trials going on before any approval by the FDA or drug controller of India. So you must keep in mind that while you are taking a drug, you must go through the knowledge about the drug. What are the expected side effects? If you're experiencing that kind of side effect, that is not a cause of much worry. But yes, if the side effects, or there is some kind of effect on your body which is not documented, or it has been documented under high risk category, then you must be very alarmed about your condition, and you must land up immediately into an emergency or casualty of a hospital. Yeah, coming back to Chinmay. Yeah, Chinmay, can you tell more about the kind of because in India the expenditure we have on healthcare is mostly out of the pocket, because the insurance, yes, many people have it, but they do take care of surgeries and stuff. But for these kind of OPD consultations, or be it the medications, so how did you manage? And till now, how user experience as a customer for the pharmaceutical industry? How much was your cost for this kind of medications? Yeah.
Ma- at first, my operation was fully covered in the insurance, as my
Yeah.
father is working in a corporate bank, and
Yeah.
so I was insured in that. That was around my single side operation was costing around 3.5 lakhs
Yeah.
in and
Yeah.
that was nearly 90% was covered in that insurance. So it
Mm-hmm.
was quite easy to manage. But
Yeah.
if a person is not having an insurance and he
Mm-hmm.
goes to those kind of corporate hospitals, he won't
Yeah.
be able to manage his expenditures.
Yeah.
And
Oh, yeah, yeah. It's good that you answered so well. I just wanted to know about the drugs part, because I was actually asking about the drugs you mentioned, that before the surgery, your surgery happened in 2019.
yes,
Yeah, so the audience must remember that Chinmay has undergone two surgeries. That is, both side hip replacement has been done. The first one has been done in 2019. The second one in August 2020, and
yes,
both the surgeries, I guess, were covered under insurance. So for the surgery part, he was quite relaxed from financial point of view. But I was, Chinmay, asking about the pre-2019 era, you can say. Means before
Yeah.
2019, all the kind of treatment, all the kind of OPDs, consultations, and the medications. So how was the financial part affected for your family, and how much tough it was to handle this kind of expenses? And about the Reiki therapy, the acupuncture,
Yeah.
the other modalities you tried, be it Ayurveda, homeopathy, yeah, the expenditure. How can you explain the average expenditure you had with all these?
Yeah. Before the surgery, I was not taking. Just before around 2 years, I have left all the medicines
Yeah.
because you can say that I was frustrated by taking all those medicines regularly.
Mm-hmm.
But I was just taking an anti-inflammatory if I required any time because sometime it was having I was having more stiffness. To
Mm-hmm.
relax those muscles, I used to take medicines once or twice a week,
Yeah.
only muscle relaxers. But
Mm-hmm.
regular medication, it was around
Mm-hmm.
costing me around 2,500 to 3,000 a month.
Okay.
Uh,
And the
and
therapy you tried? Yeah. And the therapy, be it
therapy,
acupressure,
yeah,
Reiki.
yeah,
What
yeah.
was the cost in
I
Cuttack,
was
in Odisha? Yeah.
electroacupressure. I was continuing for around 7 months, and it costed me daily 250 rupees.
Daily 250. Yeah.
Yeah,
Okay.
that
And how many sessions you had in 1 week?
1 week, 6 sessions.
Okay. So
Yeah,
amounting it
around
24 sessions. Well,
you can
20
say
sessions in
around,
a month. Yeah,
yeah,
20 sessions. Yeah, 20 sessions a month. So, guys, you can just imagine the kind of
around.
expenditure. Yeah. So he,
Not only
the
that,
yeah, yeah,
it was added with traveling also. I
yeah,
have
traveling
to
expenses. Yeah,
rent
Yeah.
a vehicle, big vehicle,
yeah,
which cost me around $1,000 daily.
yeah, yeah, yeah.
So around you can
Mm-hmm.
say that 15,000 to 20,000 a month only for treatment at that
Point, point of
severe
time. Yeah,
time.
yeah.
And
Mm-hmm.
Mm-hmm.
after that, it was like around 6,000 to 7,000 a month.
Mm-hmm.
So
Okay.
luckily, I was that privileged that my family could bear that.
Mm-hmm. Yeah. So it was a very expenditure. A lot of expenditure has been done by Chinmay. So that was I mentioning beforehand that in India, the most of the healthcare expenditure is out of the pocket because insurance, most of the people don't have it, and if they have it, the insurance doesn't covers most of the therapies and OPD consultations and the pharmaceuticals, the drug therapies. So. Small piece of advice, guys: do have a health insurance, and as you must be knowing, during this COVID pandemic, health insurance companies have got a very skyrocketing profit margin, and that's because all these fears. And I also have the same fear. Don't worry, the doctors also worry about their health. Yeah, moving on.
Yeah. So when was it was advised to you that you needed a hip replacement, and how was it? It's scary. Any operation is very scary. So how did you
Yeah.
mentally prepare yourself for that?
Uh, Firstly, I was advised in 2016. So at that time, I was not prepared for the operation. It was a major operation, as you all know, that it was a major operation. So I was not mentally prepared for the operation. Mm, Then,
Mm.
after around 3 years, I was feeling sick of the way of life I was maintaining because many things I cannot bend down or sit for more than 45 minutes to 50 minutes, then can't travel a lot, which I
Yeah.
was loving before the attack. And then
Yeah.
I I got an X-ray in 2019, and in that X-ray I can also clearly see that I don't have that ball socket joint present in that side. Both were joint were fused, So I was advised to have a hip replacement. Then I searched for the best options. My father also researched for the best surgeon in the town. So in Odisha, and I was really inspired by my physio. He is Samit Bhutia, and he really supported me throughout my operation, pre-operation and post-operation, and during the operation. He was my one of the main motivators, and my father was a big support for me, and he
Okay,
always.
and to yeah, Chinmay. So so you added about your physio. So your physio is from or trained from Oltapur, I guess.
Yes, yes.
Yeah, for the audiences, the physio he's talking about is trained from one of the prime institutes. It's SV Nitar in Oltapur. It's one of the oldest institutes and comes under a national institute for rehab. And it has been producing a good amount of rehab therapists, be it physios, be it occupational therapist, and also now adding on to it, it has also got a very good rehab department. Yeah, yeah.
Yeah.
So Chinmay, tell me more about the journey. Means the kind of psychological effect you have gone through these 3 years from the period of 2016 to 19th, when
Yeah.
every time you are deciding that yes, I should go for surgery or I shouldn't, and whether to go back to a greater life. Well, what kind of mindset you have during those 3 years? Yeah.
Yeah. In 2016, I was not prepared. Then gradually, I got frustrated from the way of life I was going through. So
Yeah.
in 2000, many times my friend would plan for a trip on bike, and I was not able to do that. That was the main
Hmm.
motivator, you can say. That was a drawback for me, but that inspired me that yes, I should go for that.
Hmm.
And then I started surfing for the results after hip replacement. I also seen the videos of the patients who have gone undergone those hip replacements, and what are
Hmm.
their recovery time, what kind of treatment they undergo, what exercises, and what a person is after the surgery. And
Hmm.
I was looking into the doctors who are mm, doctors uh, uh, who are best surgeons in Odisha as well as out of Odisha. And
Yeah.
I was looking for that, and in YouTube I got many of the options from the
Yeah.
um,
Surgical
which were,
fraternity. Yeah.
yeah.
Hmm.
And I was mainly motivated by the videos of Dr. Ashwini Maichan,
Hmm.
and he's where I was planning to to get operated there in Delhi, but
Hmm.
it was not feasible for me and my family to go there and get a operation there.
Hmm.
But then we searched around here in Odisha, and we got the contact of Dr. Sunil Kumar Das, and
Hmm.
he is a replacement specialist, and he
Yeah.
has completed his his fellowship from Australia, and he
Hmm.
is specialist in fractures and replacements.
Hmm.
So
Okay.
I was quite confident after talking to him that yes, he can do this, and I will get a better life after the operation.
Okay, that's great. So for the audiences, I will demonstrate a small session. Why it's important to get a replacement surgery, joint replacement in ankylosing spondylitis is that, for example, you can see that this is a spectacle box and this has got a joint in between. So I can just open it up and close down whenever I want. So in ankylosing spondylitis, what happens is that there is an inflammatory condition, and there is, you can say, a fevicol or something like that that joins up, and the joint is for mobility. And either, if for example there is joining now, the spec box can be closed, and in case you can see that if in a closed state it has been joined, then it can be opened up. So the same happens with patients of various arthritis and ankylosing spondylitis mainly, that their hips, in the hip, the pelvic bone and the hip bone, you can say the femur and the pelvic bone, the joint that Chinmay was talking about, the ball and socket, they join together, fuse together, and resulting in that the patient has no mobility at the level of hip. Some patients might land up with vertebrae, that is the spinal cord bones joining in, and that results in a bamboo spine kind of thing. Just like in bamboo, we have multiple landmarks, linings. So you can check that what happens is that in vertebra there is a movement happening, but if it joins, then it can't move. So that happens. I hope Chinmay has got a further future good course, and he doesn't lands up much with bamboo spine. So I hope his physios will take care of that. And Mr. Yeah. So any message for your physio? Special message, Chinmay?
Yeah, I was I'm very thankful to my physio that he motivated me for the operation and to get a better life. And yes, I am experiencing a much better life than the previous, which I was going through a previous, prior to my operation. At that time, I was not able to move around or walk for a distance of just 100 meters also. Now, if you tell me, now I can walk a kilometer and much more if I want. But
Mm-hmm.
I'm very thankful for my physio that he helped
Mm-hmm.
me and motivated me um, for the operation to get a better life.
Yeah. So Chinmay, how much the operation costed? Both the hips adding together,
It was around 7 lakhs.
7 lakhs,
Uh,
and 90% of it was covered
yeah,
with your
it was
insurance.
covered by in my uh, around 6 lakh, or it was covered under sorry, under my insurance.
Yeah, yeah, yeah.
Yeah.
Okay,
Uh,
okay. And how was your experience, particularly at the hospital level? Because Amri is a big corporate hospital. For the audiences, Amri is a corporate hospital group, mainly having its branches in West Bengal and Odisha. So it has got one of the prime hospital locations in Bhubaneswar. And Chinmay is also lucky to being operated by one of the eminent surgeons practicing orthopedic surgeons. Yeah, Chinmay, what was the experience at Amri as a patient?
it was a very good experience during the operation, pre-operation and post-operation also. It
Yeah.
was quite a great positive experience from the staff, and also from doctor side and staff also. They
Yeah, yeah.
used to clean up my room regularly. And also during the pandemic I got operated, and that was
Mm-hmm.
a that was good of, uh, quite good experience, that
Yeah,
they
yeah.
used to maintain all kind of safety measures
Mm-hmm.
in COVID time.
Mm-hmm.
Hello.
Okay. And
Hello.
about the